Go ahead.
Welcome, everyone. My name is Lisa Favela.
And I'm Iván Olivas. And we are both the Southern Region Directors of the Arizona Association of School Psychologists, also known as ASP.
So on behalf of ASP, we want to thank you for joining us today. We are very excited to introduce to you a remarkable group of local, international, and out-of-state presenters.
During November 9th through the 13th, schools throughout the United States have been celebrating the National School Psychology Week to highlight the crucial and important work school psychologists do.
So this year's theme is the power of possibility. The word possibility implies hope, growth, resilience, and renewal. Possibility suggests that even something as small as a seed can grow into something magnificent. The word power implies that things can and will happen. When we focus on what is possible, we have hope that things and objectives will grow, thrive, and bloom, empowering us to take the action steps necessary to do so.
As we wrap this week of celebration, we acknowledge the critical importance of self-care as professionals and as individuals. And with this in mind, and thinking about our communities near and far, we are honored to be able to share relevant and timely information with you all.
So presenters will be sharing about how school psychologists integrate mental health in every aspect of our job, impacting students, families, communities, and systems at large.
You will be hearing about the incidences of mental health and the impact of COVID-19 on it.
You will also learn about mental health and how it impacts culturally diverse individuals and the importance of counseling and seeking out mental health services.
You will learn how to be a strong advocate in the community to develop programs that support wellness and physical activity for children and family.
You will hear about how wellness and physical activity can be used as prevention, and you will be provided with strategies that can be applied on a daily basis for self-care, recognizing when it is time to seek professional help.
And last but not least, you will learn the importance about applying and maintaining consistency on daily behaviors and approaches to life, and gaining insight on how to face our new way of working and living.
So Dr. Diebolt will be interjecting presenters when appropriate as your questions come up on the comment section.
Each presenter will have about 15 minutes to share their knowledge and practical tools for you to take home and apply them.
We strongly encourage you to write and note important and relevant information from this presentation to you personally, as you're thinking about how you will be applying this in your daily life. So without further ado, let us begin.
Great, thank you, Lisa and Yvonne, for that. I'm going to share my screen really quickly. Oops, not the first slide. All right, so let me start by asking our audience to put in the comments box just 1 or 2 words about what comes to your mind when you read the title of today's panel discussion, Finding Balance. So if we can have some folks share that. I don't have my comments box up right now. We'll give everybody a couple of minutes to put that in there.
And Lisa, it looks like we lost Amy. And you are muted.
Okay. She's back.
Yes, so let's just give her a few seconds to rejoin.
All right, how about that?
Just give her a few seconds to rejoin.
All right, so right off the bat, I lose internet connection. Shall we try this again? Is everybody good? All right, so right off the bat, I lose internet connection. All right, I see we got a few comments coming in here. Some folks have put in moderation, not too much, not too little, staying calm, balance, self-care. All right. Let me see if I can try to share my screen again. So today we are going to, as Lisa and Yvonne have shared, we're going to talk about the current state of mental health in our country and state, and discuss the importance of providing mental health services. And also, we're going to talk about promoting wellness in children, families, and ourselves. So we do have an amazing array of panelists today, and I'm going to introduce all of them to you. Try this again. We have Dr. Torben Bergland. He's a psychiatrist and psychotherapist trained in Norway. He's currently based in the US and works on mental health promotion around the world. We also have Katina Barreda Downs-Naivalu. She's a clinical mental health counselor. Katina integrates the use of art therapy as appropriate and specializes in working with high needs and high risk children, adolescents, and families dealing with severe mental health disorders. Christine Wallace is an endurance athlete and fitness instructor and an advocate for health and wellness policy. Her advocacy experience includes writing and creating municipal ordinances and policies for promoting health and wellness. And Andrea Curless is Associate Director, sorry, I'm not advancing my screen, I'm sorry. She is the Associate Director of Wellness Council of Arizona and the National Partnership for Wellness. She's a health coach and enjoys motivating others to live a healthy and active lifestyle. So this complete biographical information is available on each of our panelists on the ASK website. But before we get to our panelists, I want to just start with a few quick statements about mental health and wellness and the practice of school psychology. Epidemiological research shows that approximately 20% of school-age youth have a diagnosable psychiatric disorder, but only a fourth of these students are receiving therapeutic services outside of school. So given this gap, school psychologists are among the de facto mental health providers for most school-age children and adolescents. School psychologists also provide crisis intervention and trauma-informed care in the schools. This work can be emotionally demanding and challenging for us as mental health providers. If we do not attend to our own functioning and wellness, we can be at risk for developing problems with our professional competence and our own mental health. So we have an ethical obligation to practice self-care, and we need to practice self-care in order to prevent burnout and promote our own wellness. So I want to share with you an article from the December 2016 and January 2017 edition of the NASK communique. The authors, did I share my screen? Let me just double check here.
It is not shared
It's
currently.
not shared. Okay, I do want to put this citation up. All right. All right. This is an article I want to share with you from the NASK communique, as I said. The authors are Paula Gil Lopez and William Bentley, and they describe both temporary and enduring types of self-care. When we're using temporary strategies, we have these kind of feel-good neurotransmitters such as dopamine and norepinephrine, and they're released in the brain, and they give us like a feel-good feeling. This is things like spending time with friends, maybe changing your eating habits for the day, doing some things pleasurable like reading for pleasure. These make us feel good, but they don't have long-lasting effects because those neurotransmitters are released and then they subside. So one of the things that I want to have everybody think about today is more enduring strategies. These are permanently strengthening your brain functioning. It means that with regular and repeated practice, these strategies change the structures of the brain. We know this from research on the effects of trauma, as well as research on the effects of wellness. So enduring strategies we're going to be talking about today are things like mindfulness that become part of our regular routine, activities such as journaling positive events and exercising regularly and maintaining a healthy diet over the long term. The problem is that although we understand the importance of self-care, school psychologists and other mental health professionals, we may not practice what we preach. So I learned this firsthand through my own behavior when I've been doing crisis intervention types of counseling, as well as my experience as a lead psychologist. So I have a personal story that I want to share. One year, we had a particularly stressful year. And as lead psychologist, I wanted to provide a day of wellness for our school psychologists. Ironically, now in retrospect, I realized that that stressful year that we had was a walk in the park compared to our current stressors. But that said, what I had envisioned was something like a spa day. I planned a wellness day, and as I was planning this, I found out that our district's wellness department could help me with this. And I encourage everyone to reach out to your wellness department if you have similar department in your district. See, I always knew that our wellness department did things like those well-publicized events like Biggest Loser contests, posted health information about getting flu shots, staying hydrated. What I didn't know is how much more that they could do for the staff. So I got them involved with my wellness day, and they actually just took it over and did an amazing job. They had a nutritionist talking about dietary changes for the long haul. We had a yoga instructor providing exercise and relaxation. And then we also had massage therapists who came in and aromatherapy and really kind of focused on relaxation for the long term. But what was interesting is that I had all the psychologists rotate through these stations. Sounds good, right? Well, at the beginning of the day, I had at least 10%, a handful of school psychologists come to me and asked to be excused from the wellness day. One told me, if you really want to reduce my stress, you'll let me get back to my office and write reports. So I asked all of the psychologists to bear with me and stay, and they did. At the end of the day, they all came to thank me. They really didn't realize how much they needed that day. And one particular story really resonated with me. I had one psychologist who called me the day after to share his story. When he got home, he walked in the door and his wife immediately said to him, "What happened to you today?" And he asked, "What do you mean?" And she said, "For the first time I have ever seen you walk in the house, you had a smile on your face." So he's a great school psychologist, great mental health provider, and he had no idea how much the stress was affecting him. So my message to all of you is listen to our fantastic panelists. And as you do that, think about how you will use this information, not only to care for your students, your families, your staff, but also to care for yourself. Self-care means putting self before others. It's similar to what airlines tell us. You need to put on your own oxygen mask before you put one on somebody else. So with that, I would like to turn it over to our panelists. We have Dr. Bergland to go first. Dr. Bergland wasn't able to be here in person, so he has taped his discussion, and so we won't be able to field any questions about his presentation. But I'm going to go ahead and hand it over to Dr. Bergland.
Thank you for this invitation to be with you and to share some perspectives, some data on the very special situation that we are in this country and as a world in the midst of this pandemic, and how it impacts the mental health, the mental well-being of our population, and especially want to focus on the younger part, the teenagers and the young adults among us. I will also share with you briefly some reflections on the role of exercise, physical activity, as we are trying to cope with the challenges that we are faced with. So I have called my talk "The Mental Health Pandemic of COVID-19" because that's really what we are facing at the moment. It's really not just a pandemic of the coronavirus, but we are facing a mental health pandemic in this also. Some of the data that I will share with you is from possibly the best database we have on health data. It's the Institute of Health Metrics and Evaluation, and it's recently been updated with 2019 numbers. And the link is there. If you ever need data, I would recommend to go there. You can generate graphics, as you'll see I have done, play around with it and find many interesting things there. First, the prevalence of mental disorders in the US. The historic trend from 1990 until today. And as you see, there's been a slight increase in the recent years of mental health disorders. This is not corrected for the population growth overall, so I assume there's been some population growth in the US through the last 30 years, but still the trend is there. And as you can see, the big disorders that we're facing are depressive disorders and anxiety disorders. That place is true for around the world. These are the major issues, but there are also several others. So in total, more than 50 million people in the US in this moment are struggling with mental health issues on the level of a diagnosis, a disorder. That means they are in need of help. I have taken this data specifically for Arizona. That's what you can do with this tool. So this is in Arizona, the prevalent cases according to age groups. And then you see the interesting thing, as kids grow up, when they are in the group 15 years older, that's where they are really facing mental health issues and challenges. Almost peaking in that age group already. So late teens, young adults, many of them have mental health issues. More than 20% of them struggle with mental health issues on the level where it is a disorder, considered a disorder. They are in need of help, support in Arizona, in your state. This is the trend that we've seen, and it's sort of similar to the US trend, some slight increase in the issues of mental health disorders in this age group, 10 to 24-year-olds in Arizona. And again, depression and anxiety are the big ones that people struggle with, young people struggle with. If we view it from the incidence perspective, number of new cases per year, then you see the trend here also, like, and depression is the big one. You may wonder, well, how come the incidence of depression is so much bigger than the incidence of anxiety? Well, that is the nature of these disorders, that depression typically is more time limited, while the anxiety issues are often more chronic, more long term. That's why we have many new cases of depression every year, but still anxiety remains a big issue among young people. And you see the trend here also similarly, lots when people get into the late teens, they really hit with mental health issues. Depression is the big one. So lots of young people struggling with these issues in Arizona. Suicide, the most tragic outcome and the most feared outcome of mental illness. Majority of people who die to suicide are struggling mentally in some way or another. And in this young age group, again, 15 to late 20s, suicide is the second leading cause of death in this population. Second, not to any physical illness, second to accidents. Young people, they lose their lives first and foremost because of accidents. Second to that, because they end their own lives by suicide. And just for perspective here, this graphic shows the number of deaths, total deaths in the various age groups. And it compares it to interpersonal violence. These are people either who kill themselves or are killed by others. And you see all age groups here, or as they are 10 years and older, that more people die to suicide than died to homicide, that they're killed by others. And you can see in the young age group makes up like around 20% of the total numbers of deaths in Arizona for this young people. And here it's the numbers of suicides in Arizona in the age group 10 to 24 in 2019. Total more than 150 suicides in Arizona in this age group in 2019. And the typical pattern, more boys, young men die to suicide than women. The paradox is more women, your girls and young women attempt suicide, but often by less lethal means. So we see this typical trend, higher numbers of suicide among boys, men, of all ages, basically. So how has COVID-19 impacted this situation, the mental health situation? These were 2019 numbers that we were talking about before COVID-19 hit us. In August this year, the CDC published a report that really shows alarming numbers. In the general population, more or 40% of US adults reported struggling with mental health and substance use. That's a major increase from around 20% in before. Anxiety and depression symptoms, 31% report symptoms on the level that it would qualify for a disorder, for a diagnosis. Trauma, stress-related disorders, 26%. People who have started or increased their substance use, 13%, and the ones who have seriously considered suicide in the last 30 days, 11%. And I recommend to read this report. The link is there. It's a good report. It's an alarming report. It's worth to know it. What we see here in this report, just some highlights, that anxiety disorders up about 3 times compared to 2019, depressive disorders up approximately 4 times the self-reported symptoms levels in the population, up about 4 times. And really alarming, the 18 to 24-year-olds, younger people, were not included in this study. 18 to 24-year-olds are the ones struggling the most. 75% reporting adverse mental or behavioral health symptom. It seems like even though the young people are physically the most resilient, considered the most resilient to this coronavirus, the COVID-19 illness, still mentally, they seem to be the most vulnerable. When it comes to suicide, general population numbers are up about twice, about 10% having seriously considered suicide in the last 30 days. And again, 18 to 24-year-olds, 24.9% reported having seriously considered suicide in the 30 days before completing the suicide. 1 in 4 in this age group reported having seriously considered suicide. These are alarming numbers. Stress in America is a report that the American Psychological Association publishes every year. And of course, the 2020 report focuses especially on COVID-19 pandemic and the impacts of that. And it says, again, I recommend reading it. The link is there to the report. Americans have been profoundly affected by COVID-19 pandemic and the external factors Americans have listed in previous years as significant sources of stress remain present and problematic. So the pandemic just comes on top of these things that people have been struggling with before. These compounding stressors are having real consequences on our minds and bodies. It is, and this is where the American Psychological Association sounds the alarm, it is the unusual combination of these factors and the persistent drumbeat of a crisis that shows no sign of abating. And we know now it's worse than ever, that is leading APA to sound the alarm. We are facing a national mental health crisis that could yield serious health and social consequences for years to come. These consequences of this pandemic, they won't go away the moment we have a vaccine, the moment we have the spread of the coronavirus under control. These have major impact consequences for the population long-term. The potential long-term consequence of persistent stress and trauma created by the pandemic are particularly serious for our country's youngest individuals, known as Generation Z. Our 2020 survey shows that Gen Z teens age 13 to 17 and Gen Z adults age 18 to 23 are facing unprecedented uncertainty, are experiencing elevated stress, and are already reporting symptoms of depression, and not only depression, as we now know. So looking especially closely at these groups, Gen Z adults have largely grown up during times of disruption and unrest. If we look in the years we had behind us, it's been turbulent years, and this is the world the Gen Z adults have grown up in. Many say the rise in suicide rates, widespread sexual harassment assault reports, the Me Too movement, 58%, and the change in abortion laws is a source of stress. Nearly 8 in 10 Gen Z adults say the future of our nation is a significant source of stress in their lives. Gen Z teens, the younger group, 13 to 17, they are struggling with uncertainty of their futures as well. 50% say the pandemic has severely disrupted their plans for the future. 51% that the coronavirus pandemic makes planning for their future feel impossible. This is a difficult situation to be in when you cannot plan for the future. Most Gen Z teens who are in school, 81% report they have been negatively impacted due to school closures as a result of the pandemic. So this is a difficult situation we are in. You probably have been exposed to it. Many of you, you know it, you have heard it, you've sensed it, but this is now being supported by the research being done coming out. So what can we do? Well, physical activity. What is the role of physical activity, exercise in this? Why emphasize physical activity and exercise? Just want to refer to this article published by Walsh in the American Psychologist, and the link to the article is there. It's a very nice, comprehensive article, not too long, but it summarizes various dimensions of lifestyle, including exercise and its impact on mental health. I would recommend it. It says exercise offers both preventative and therapeutic psychological benefits. In terms of prevention, both cross-sectional and prospective studies show that exercise can reduce the risk of depression. And in terms of therapeutic benefits, responsive disorders, according to literature, are depression, anxiety, eating, addictive, body dysmorphic disorders. These are issues that young people struggle with, the age group that we want to target. Then beyond that, exercise also reduces chronic pain, age-related cognitive decline, severity of Alzheimer's disease, not things that young people are affected by, but still also symptoms, some symptoms of schizophrenia, which often comes in the 20s. In terms of therapeutic benefits for mild and moderate depression, it compares favorably with pharmacotherapy and psychotherapy. Doesn't mean that it replaces either of them, but it should be used in connection with these other modalities of treatment and support that we can give. Both aerobic exercise and non-aerobic weight training are effective for both short-term interventions and long-term maintenance. And there appears to be a dose-response relationship. The more you do, the better, with higher intensity workouts being more effective. Exercise offers, and again, benefits. The proposed psychological mediators include changes in serotonin metabolism, improved sleep, as well as endorphin release and the consequent runner's high. The good feeling that you have after exercise is beneficial for also mental well-being. Psychological factors include enhanced self-efficacy and self-esteem, something that is very important to young people, interruption of negative thoughts and ruminations, and perhaps the breakdown of muscular armor, this body tension, the chronic psychosomatic muscle tension patterns that express emotional conflicts and are the focus of somatic therapies. Exercise increases brain volume, vascularization, blood flow, and functional measures. Then interesting, then notice there seems to be a threshold effect for session duration, because sessions shorter than 30 minutes, while valuable for physical health. It's fine if you want to benefit physically from exercise. Less than 30 minutes is still positive, but it's not seemingly as positive to gain full mental benefits. They yield minimal cognitive gains. Cognitive benefits are enhanced by more strenuous activity and by combining strength training with aerobics. Then finally, fortunately, even brief counseling can motivate many patients to exercise. It's not that hard sometimes to get people to move more. Don't need them to have them run a marathon, but to move more is a good thing. And the risks are minimal, especially for young people. Yet despite this, despite the many mental and medical benefits of exercise, only 10% of mental health professionals recommend it. That's troubling. Who are these 10%? Not surprisingly, they are likely to exercise themselves. So this is the challenge as you are trying to help these people. And if you're going to recommend physical activity and be more motivated yourself to recommend it, you should probably do it yourself. It will benefit your mental health, your well-being, and you will probably also do a better job with your patients and all the benefits that goes with exercise. So that's the personal challenge in this. Thank you very much.
Right. Thank you very much to Dr. Bergland. Is my screen sharing okay here?
Looks like it's the end of the slideshow that's displayed.
Oh, for heaven's sakes. Okay. All right, so thank you, Dr. Bergland, for that presentation on the potential long-term consequences of stress and trauma related to the pandemic, and the benefits of physical activity to treat those stressors. Our next presenter is Katina. Let me see if I get here. Katina Barreda Downs-Naivalu is a clinical mental health counselor, and she's here to share some additional information on the benefits of mental health counseling. So I will go to hand it over to Katina. Thank you.
Thank you so much, and thank you for the invitation as well. Definitely it's important to talk about the impact of mental health, and let me go ahead and share my screen. All right, and I am going to be talking about mental health and also cultural impacts and diversity impacts as we go on. It's important to talk about how, what's the importance really to seeking mental health services, and there is certain impairments that come and difficulties that come that are natural when we're dealing with difficulties with our mental health. Just to put it in perspective, the World Health Organization states that mental health is a state of well-being in which the individual realizes their own abilities. They can cope with normal stressors of life, work productively and fruitfully, and is able to make a contribution to our community. That means the person is thinking clearly, they're able to manage normal daily stress that comes with lives, also are doing relatively well in their school or work, keeping up with school homework or whatever duties they have. People are organized, are able to also socialize well and contribute as well to their community or people who are around them. So when we are dealing with mental health issues, we may begin to feel not so much like ourselves anymore. And so at that point, it's a good place where we need to begin to pay attention. What is happening with us? And it's important to notice our thoughts. And if we begin to notice more negative thoughts, our emotions are getting just, more negative. Maybe our sleeping habits or our eating habits may be impacted. We may be eating more or less, or we may be sleeping through the day, just changes with sleep. Social relationships or family relationships may also become impacted. Maybe we're having more disagreements, or maybe we're isolating from people around us. Also, we may begin to experience disruptions on our daily, work and school functions. And again, our behaviors may change. So there is impact really all the way around. And we're gonna get to talk a little bit more about stigma, but these impacts everything, and everything really is connected with each other. There might be some behaviors that we notice if we're working with children. There might be rude, kind of difficult, or maybe sleeping through. It's important to notice, well, yeah, maybe it's not necessarily all normal. A lot of the times when we work with parents, because things have been so prominent or they have gone on for a long time, things may begin to seem as they are normal. But are they really? So it's important to kind of explore that idea and really understand, is this really normal how everybody else functions? I think that it's important to recognize there is people who may say, well, I think I can just do this myself. I can, handle this. And when is it appropriate to seek for professional help? So a good idea is, well, if we're experiencing some small declines in our functioning, just maybe an area or two are becoming impacted, things are just not going as well or smoothly, yeah, maybe there is an opportunity where I can maybe do something, just, handle things myself and do a lot of more of self-care and so forth. But when things are getting a lot more difficult, life is just becoming impacted in so many areas, like the ones that we just talked about, definitely seeking professional help so that we may learn ways to how to improve different areas. So a good idea is to look at our productivity. If we're working or if we're studying, are we getting the same amount of tasks completed? Are we as effective? Are we, having a sense like we're kind of stuck? Or are we thinking that maybe there's not a point in living, or just kind of wanting to give up? Sometimes we may even begin to think about, oh man, I wish I was dead. All of those are important things, important red flags to look at. And that's indicating us that it's we're right there where we need to be looking for professional help. Sometimes we can just shake off things that happen or things that we witness. Things are coming and coming back to our minds and we can't get past it. Or we might be beginning to try to numb our emotional pain. And that could be seen in so many ways through the use of substances or in increasing some other addictive behaviors, trying to not think about what's happening. So the importance of seeking professional help when it comes to mental health, it's because if it's utilized correctly, if we reach and find a service and we begin to participate in this service, it really helps to put a break on kind of going on a downward spiral. It has a huge impact on physical health. And we have found that it improves the ability to complete other treatments, either related to other health conditions. Eating and sleeping habits get better. Our immune system also improves. There is also pain that is connected, physical pain that is connected to mental health. So we want to make sure that we're getting attention also if we're having a lot of pains and aches, and that helps. Mental health treatment helps to mitigate that as well. Of course, our mood, social relationships, or productivity get better. And according to a July 2020 study published by the Journal of Psychosomatic Research, it also seems that our life, because it's connected to people living longer. So it's an interesting connection there. It's not just the quality of life, but also the length of our life. So when we're talking about mental health and minority groups and different cultural groups in the US, because there is so many different cultures coming together, it's important to look at the cultural views of this group. It's important to consider the past experiences that they might have gone through. And these are important considerations because these may also play a part on seeking services or following up with services that were recommended, like if you're, providing options for treatment and explaining access to several treatments. This may impact the person with the follow through. There might be some misunderstandings. The person might refrain from participating in services because maybe they feel that they might be misunderstood by the main culture. There might be mistrust in the process, and there might be some stigma too that might come from their own communities, such as, well, if I seek mental health services in my own small community, they might think that something is wrong with me, or I might not be accepted. So all of those are important things that kind of get in the way of serving different groups. It's important to look at our own biases as well, and working to increase our own awareness about these biases. And it is an ethical duty that we have to maintain ourselves aware and work on our own biases as we continue to work with different groups. Let's be aware of communication styles, and sometimes these might impact how different minorities or other groups might just even continue services, as sometimes they might explain things more in like a story, or let me give you all this feedback, and the person may be doing the assessment or the counseling might be like, no, just answer the question. And the person might feel, oh, they're dismissing me, they're really not interested on what I have to say. It's not that the person is trying not to participate, but maybe it's just their communication style. And just we want to be aware of that. And we were talking about and let me go back. So low context versus high context communication. So some cultures might really, as I was saying, rely more on direct communication, and this is a specifics of what's happening. People with high context cultures might use more nonverbals or subtle cues for communication, or might be less specific in their communication style. So it's important to consider that. And so this slide kind of puts in perspective different cultures and where the US is, and then where other cultures or groups that we work with might be. So it's important to keep awareness on There might be also systemic issues on how minorities access or participate in mental health services. And this also has to do with lack of or poor information on how to navigate a mental health system that might look very different from home culture. There might be other issues such as access to transportation, language limitations, even the use of translation, and all of these things contribute to the success or the engagement of a person in the services. I would like to show this little clip. I hope it's not too strong. It does use a tiny little bit of language, but it's kind of funny and sad at the same time. And it's just a super short clip. Let me go back. Oh, 1 second.
Your name, ma'am?
María.
Last name?
María.
No, your last name.
Sí, María.
What about a middle name?
María.
Can I please see some ID, ma'am? So what exactly happened today?
Pues estaba trabajando, ¿no? En el bar usualmente. Y llega un chico y ordena un tequila. Y luego otro, y otro, y otro. Y 6 tequilas después, se me va sin pagar.
Ma'am, you know I can't understand shit, right?
María.
Can we get a translator in here? Hola.
¿Ese es él? El güey el que me robó el tequila.
What did she say? She said she wants some tequila. Tell her this is serious. She can get a drink on her own time. Por favor, no digas que fue yo.
Es que tú me robaste, eres un criminal.
No, no lo soy. Solo tenía mucha sed.
¡Criminal!
She says the guy was a criminal. Yes, we know that. Tell her to describe him. Quiere que describas al hombre.
¿El hombre es tú?
Bueno, no le voy a decir esto.
Pues perfecto, mira, está chaparrito, latino, tiene un bigotón y tiene una camisa azul con una corbata.
She says he's tall, white, blonde hair, blue eyes, no mustache, and no tie. Good, good. Ask her if she's sure that he was white. Wait, why does that matter? A white guy drinking tequila in the morning? Come on, good point. Le pregunta que si está seguro que es gringo.
¿Y pues eso qué importa?
Él no cree que un gringo tome tequila.
Ah, no, pues sí, buen punto.
Yeah, definitely a white guy. Okay, ask her what happened after the incident. Si no dices nada, cubro tu turno en el bar toda la semana.
Trato hecho, dale.
She says she doesn't know. Does she have any other information? ¿Tú qué haces esa noche?
No, pues nada. De pronto verme un episodio de ese show Game of Thrones.
She says she has no more information. Ask her if the bar has a security camera. ¿En qué temporada andas?
Yo acabando de terminar la 6ª temporada.
She says no camera. Okay then. Guess we're done here.
En realidad, ¿cómo agarraste un trabajo como traductor? Tienes que ser inteligente, ¿no?
She wants to turn herself in. What? Yeah, she just admitted to stealing from the bar herself. Are you serious? Yes. Ask her if she means that. ¿Te gusta mucho Game of Thrones?
Sí.
Sí. Holy shit, ma'am. I'm afraid you're under arrest.
A ver, ¿qué dijo?
Dice que gracias por tu cooperación. Who the hell are you?
¿Quién es este, eh?
I'm the translator. I was told my services are needed. Then who are you? No hablo inglés.
So it's a little bit sad in the sense of how translation is an issue. Of course, this is, kind of a little bit dark comedy or whatnot, but it's a true issue in terms of access to accurate translation, accurate, provision of services because of language differences. So it's definitely recommended to be able to have a provider who uses or who is very knowledgeable of the language of the person. And lastly is really encouraging self-help strategies. And this has been covered a little bit as well. And I know they will be covering more on this, but really it's just being able to access ways to help our mental health, whether that looks not just like, you know, yoga, but like reflecting on things, meditating, praying, journaling, being able to exercise. And we've just talked about all of the benefits of exercise, creative outlets such as art and, you know, writing and so forth, painting, and even music, whether it is writing music or listening. But these are all healthy ways on how we can just begin to integrate more and more to help cope with our stressors. Thank you so much. This ends my presentation.
Thank you very much, Katina, for that wonderful information about recognizing the need for seeking out mental health services, the benefits of mental health counseling, self-care, and those really, really great cultural issues related to mental health services that we all need to be thinking about. Our next presenter is Christine Wallace. Christine is an endurance athlete and fitness instructor and an advocate for health and wellness policy. So Christine, I'll turn it over to you.
Thank you so much for having me be a part of the presentation. Hi, can you hear me? Hi, I hope you can hear me.
Yes, we can.
Okay, perfect. Yes, thank you so much for having me be a part of this presentation. I actually have a lot of experience in this field, and I'm really excited to see that this field is starting to incorporate mental health with physical activity. I'm just going to give you some background of some of the things that I've done, which can hopefully help some other people in communities perhaps do the same thing or take some ideas of some of the ideas that I've done. But I come from a very diverse background. My mom is from Trinidad, my dad is from Germany, and I'm from Canada. I married a US citizen, and we lived in the United States for a number of years. So I've been exposed to a lot of different cultural backgrounds, religions, and ways of doing things. And my master's degree is actually in international and community development. One of the most important aspects of international and community development is conducting needs assessments in communities that you want to help. So, for example, if you go into a community and you want to help with their health and wellness initiatives, one of the things that you can do is determine whether or not there has been a needs assessment done. And you can do this through the government, not-for-profit organizations, community organizations, and faith-based organizations. You would want to interview stakeholders, and these stakeholders would include government entities, so municipal governments, state legislators, senators, county commissioners, businesses that focus on health and wellness and activity, parks and recreation, and their boards, schools, community groups, and once again, faith-based organizations. And then you want to determine what the needs are from the needs assessment, because you can have really great ideas and be in a community, but if those ideas don't match the needs of that specific community, then that idea is not necessarily a good idea for that community. So it's really, really important when wanting to help a community in terms of health and wellness to do this needs assessment. And a needs assessment can be done through, it's one of the research, you can use a research tool. So focus groups, questionnaires, those kind of tools you can use for a needs assessment. One of the things that I've done, so I'll just talk about a little bit of my background in this. I was in Southwest Michigan for about 4 years, and it's a rural community. There was a university there. It was a very big faith-based community. But what I noticed was that, and I was put in a position where I can actually, I was the chair of a health and wellness committee. So one of the things that I did right away was interview people who attended the faith-based community, did questionnaires and surveys. And then me and my health team, we determined that the needs that were wanted in that community were a few things. One of the things was called Mommy and Me. And so that was a group of moms with children 5 and under. And there were no such groups in the area. So what I found was that, and research shows that moms who, so postpartum depression is actually quite prevalent and amongst many moms all over the world. And this specific area wanted a group where young moms could meet and their little ones could play. And so I got funding from that faith-based organization to run such a group. On the first day we operated it, we had 60 families. We were expecting maybe a dozen, but the word spread very quickly. I only advertised it for about a month. We only advertised it in social media and through that faith-based organization. And we had 60 family members attend for that first meeting. So that was a little overwhelming. I had to improvise very quickly with the materials and the crafts. But part of that group, Mommy and Me, we incorporated physical activity, and that I called that Fit Kids. And so 10 minutes of the hour and a half program included physical activity. So moms with their babies or infants or young children doing interactive exercise. It was so popular, and I've heard that it's still running now. So 10 years later, it has been I set it up so that it could be sustainable. So I partnered with the university, and we had education students doing some of their credits there so that they can gain credit. And one of the things that you want to do when creating a health and wellness program is to partner with as many people as possible. You generate ideas, you get help, and it's a win-win for the students because they're getting educational experience. You figure out what exactly the professors want from out of your program, and it really is a win-win. And the people who benefit are the people you're trying to target, and that's the community. So that was one thing we did there. The second most, the biggest need in that community, so I actually did this 11 years ago, was the needs assessment. Was a walking club and a running club and free exercise classes. So again, I partnered with the university so that we could have some of their exercise science students doing some of their practicums for group fitness in the class. And we had waivers, and we set it all up so that the students were getting credit, the people were getting free workouts, and we were doing it in a very welcoming environment. It was very popular. And again, those programs are still running today. So when you're creating, so for international community development for wellness programs, you want to create sustainability so that when you, the idea person, leaves, it just keeps going. And so you do that again. And the way I have found that works, and through research, at bringing in as many partners as possible, not making it all about you, not making it your own, but it's the approach is a group approach to benefit as many people as possible. So that was in Southwest Michigan. Then we were in Morgantown, West Virginia for a number of years. And I got heavily involved there. Actually, my whole family did. My husband, he was a city councilor. So having a little bit more access to government actually made things a lot easier because once you understand how the city works and ordinances and bylaws, you can actually, if you have a really good idea, you can actually bring that forward a little bit more. So there was a needs assessment that was already done. It was done by the university. It was actually done by the West Virginia University School of Public Health. And so I really looked at that a lot. They partnered with the hospitals there in doing their needs assessment. And they also partnered with the local governments, local organizations, social service agencies, which in that specific area helped a lot of people. So social workers, social service agencies, they really helped a lot of the sort of at-risk population in that area. So looking at that needs assessment, I determined that there was a huge gap, and that gap was an actual board and commission at the municipal level. So I did a lot of research on this, and I looked at the different boards and commissions, municipally run boards and commissions for health and wellness all throughout the United States. And I found health and wellness commissions that in towns that were identical to or similar to the size and the demographic of Morgantown, West Virginia. And then from there, I did a little bit more research and I combined the needs assessment into that gap. So the gap was there was no health and wellness commission at the municipal level. There was a board of health. And I found that the board of health in that area specifically, they were dealing with infectious disease, and WIC was in their office. And so you had a lot of those, like public health, definitely health and wellness, but something that was not so needed by the general populace. So looking at that, I researched and created the Morgantown Health and Wellness Commission. There are so many things that health and wellness commissions can do, from researching paid sick leave, your tobacco laws. There's a lot they can do. In LA, they're actually part of the 2028 Olympic committee. Their Health and Wellness Commission is. So a broad range of benefits of having a municipal health and wellness commission to address the specific health and wellness needs of that municipality. And so we created the Health and Wellness Commission, and I helped write the ordinance, and we've since left Morgantown, and it is once again still operating. From there, I also created so using their needs assessment, we determined that local sports clubs at low cost was needed. There's a lot of low-income families in that area, and so they're not going to pay for expensive gym memberships. So we also created a running club. It was called the Morgantown Youth Running Club, and we had and we offered it the same way with sliding fee discounts. And so we had a lot of kids run with us at a low cost and or free. I was also a home visitor at the time for the Maternal Infant Health Outreach Worker Program. And so that's what I was doing as a job. And I was working a lot with Title I children, at-risk youth, and parents living in Section 8 housing. And so I had parent classes, and I was also working in the homeless shelters as well. So all those kids that I knew the parents were not able to afford any kind of sports programs for them, I actually let those kids all in for free, and they were able to gain friendships, have social interaction, and experience the positive benefits of physical activity. Just like Dr. Bergland was talking about the positive effects of exercise on the brain, I felt after researching it as well and being a home visitor and going through a bunch of training and realizing the toxic stress on the brain, that, even though these children are going through traumatic situations, why not offer this for them? Why not have them experience socialization and sports that other kids can have? And then they feel good. They all have that endorphin rush at the end. Nobody in the club knew who was homeless and who was not homeless. We did a good job of keeping that quiet. And so I felt like that was a really good thing that we did in the community. And one other thing we did was a swim team. and swimming lessons. So drowning is one of the top, I can't remember the statistics here, but I think it's one of the top 5, if not the top 3 leading causes of death. So in accidents for children 12 and under. And so in West Virginia, and in that part of West Virginia, the swimming lessons were quite expensive. So I was able to get a grant, and the grant actually came through California it was drowning prevention. So it was drowning prevention, so public health and safety, but at the same time, because it's physical activity, it was also health and wellness. And so we combined the two. So they were getting the benefits of both. And again, at a low cost or no cost to a lot of those at-risk parents. And lastly, now we're in Toronto, Canada. And I thought, okay, well, we have a lot of free stuff up here. There's not a lot I can offer. Toronto seems to have it all covered, except now COVID-19 hit. And with COVID-19, we had a lot of families who were put in very stressful financial positions. Once again, when you're vulnerable, you cannot afford a lot, and you're not going to be searching everywhere for these programs for your kids because, frankly, sports programs are not the top priority. So we are now offering virtual classes and in-person classes at very low cost to the community, running fitness and virtual classes. And in the coming months here, I'll be expanding that a little bit more to specific communities that I've researched since being here for a year and a half, that I can see that there's a greater need in specific parts of Toronto, lower income, high immigrant areas, where sports is just not a priority, and children are not going to be exercising as much as their peers in some of the more wealthy areas. So I would recommend, after my experience for the last 12 years, all over North America, collaboration is one of the key ingredients to success in creating sustainability in a health and wellness program, making programs accessible. So social media, I'm getting a lot of people coming to programs through social media. A lot of people have Facebook. There's Instagram. I think there's other social media. Those are the only 2 I'm personally familiar with. But a lot of people are on social media. So making the programs accessible, not too difficult, not competitive, but bringing in as many partners as possible. And when you work through not-for-profits or faith-based organizations or even municipal governments, one of the benefits there, as opposed to totally for-profit, is that you have access to grants. And there are philanthropic agencies out there that want to help specific communities, and they want to help promote physical activity. There are so many benefits for physical activity, and as we know, it helps the brain function and all those wonderful things that are experienced with exercise. But also what you want to promote is social interaction too. I find that people are more accountable when they have people to work out with. Children have more fun, and an hour of exercise can go by so much quicker than if you're exercising by yourself on a stationary bike or on a treadmill. So collaboration, partnerships, and making it fun and social. Thank you.
All right, thank you so much for that, Christine. I do want to thank you. That's great information about establishing sustainable wellness programs in our community. I love the information about partnerships. I think that that's really, really important. Let's hear from another panelist here. Our next panelist is Andrea Curless, who is Associate Director of the Wellness Council of Arizona and National Partnership for Wellness. So take it away, Andrea.
Thank you very much, Amy. I appreciate it. And I'm so happy to be here. So let me go ahead and get my screen up. It looks like my video is off right now too, so we'll get that going. So hi, everybody, and welcome. And I'm going to be brief, be brilliant, and then I'm going to be gone. So then that way we try to stay on track. So I'm going to move through this a little bit quickly. But with that though, just know that all this material is available to you all. So you'll just have to reach out to your partners and then they can get you the material that I'm actually going over right now. So we're going to actually start with what we call the awareness approach. And really this presentation is more about you. This is about you, because we know that when we become healthier, then we become a better servant to others. So I want you to actually start taking care of yourself first before you can ever take care of anyone else. And by doing that safely and effectively, and do it mindfully. So as they stated, I'm from the Wellness Council of Arizona, also known as the National Partnerships on Wellness, and we do worksite wellness initiatives. So today I'm going to ask yourself a couple questions, and I know everybody's going to say yes to every single one of these, especially the last one, but do you work on multiple tasks at the same time? Well, of course you are. You're probably doing it right now. You're listening to this presentation. You're probably filling out what you actually did for the whole week. You're planning your weekend, or you're getting ready to plan for the next week, or you're getting ready to actually do another type of project. You're getting ready to start it, or you're ending it. Do you check your emails while you're talking on the phone and eating? I would have to say that probably at least 95% of you guys just said yes on that one as well. Do you work on more than 3 projects in various stages of completion at one time? Now, this one here right now, during the times that we're going through with COVID-19, and we're working usually from home, most of us are working from home. And if we have family also working from home, that means that probably just got doubled or tripled. So you might be working on your 3 projects or more, but you're also helping and supporting all the other people that are actually within your tribe, and you're doing the same thing. And then the other one is, are you answering calls or texts to, from clients or family or colleagues during your meetings? And we know that people do that all the time. You can just watch on Zoom and look how many people is looking down and they're actually texting or answering a question. But what actually happens is that you lose sight of being actually in the present moment. So the reality is this. Yes, we understand that right now that we are being pulled in many, many different directions. But we have to come up with a solution to find balance. Now, currently right now, we're all working in what I would call chaos. We're just managing the chaos right now. And that's okay, because once you become aware that you are in a chaotic type of situation, or that you're not being able to spend time for self, or you're not putting yourself first so you can be a better servant to others, then you know that you need to actually have the awareness approach. So we need to get back into mindful thinking. So what is mindfulness? You hear that big buzzword out in the wellness community right now, be more mindful. You need to have more mindful thoughts. So what it really is though, it's the mental state that is achieved by focusing your awareness on the present moment. So right now, just for the next 15 minutes, even less than 15 minutes, I want you just to be present. I just want you to be present for your own benefit, not for my benefit, but for your own benefit, because you never know. Something very, very small is going to happen to you, probably today, tomorrow, tonight, and it won't really mean anything at all at this moment. But later, all of a sudden, it will. It'll just happen. So I want you to constantly just be thinking about that. Something really, really small is going to happen to you today, and you're not going to really absorb it, except for it's going to be in your brain. You're going to be mindful of it at that moment. Might not be relevant right now, but later you will. So be aware in the present moment of exactly what's going on. So there's 7 ways to be mindful at work, but it doesn't have to just be work. And when I say work, I'm talking about everything that you're managing in your life. There's ways that you can actually be more effective and be more mindful. I love the picture that's actually in the top right-hand corner, because I think a lot of times our significant others, lovers, or our partners, or our children, we're all at a different stage. So some of us are mindful, and the other one is maybe mindful. So think about trying to bring everybody together at the same time and be mindful, not just mindful, but mindful. Okay, so this is your first tip. So this is actually the one that I really want you guys to take away from. And like I said, there is a supporting material that you could reach out and receive that will take you through several different types of breath work. But right now what's happening is we have become shallow breathers even more today. You've heard a lot of professionals talk today about aerobic activity. Well, aerobic activity increases your volume of oxygen. What that does, it increases the amount of oxygen that your lungs can support. And right now we know with COVID, it's a respiratory disease and it affects our lung. It affects our ability to breathe. So if we learn to open up our volume of oxygen through deep breathing exercises or just being aware of what's actually happening with our breath, we can actually increase our volume of oxygen through aerobic activity, but also just through deep breathing. So just take the next 60 to 90 seconds, and I want you to switch your focus just on your breath. So everyone take a big deep breath in. Now hold it, and now slowly let it out. Now there's a great exercise on here. It's called the 4-7-8. It's by Dr. Andrew Weil. And it's really what they want you to do is exhale completely. Just get rid of all the oxygen that you possibly can. Then they want you to breathe in and just count to yourself by 4. Just 1, 2, 3, 4. Then you want to hold your breath and count to 7. And then you want to exhale all that breath out of your mouth and count to 8. Now, some might not even have enough breath in our system because our volume of oxygen is so low that we can't even make it to 8. But as you continue to keep practicing this, it's a great way to practice it when you're waiting for something, or you're maybe cooking, or you're helping a child through their homework assignment at home, or you're getting ready to go from one more task to a new task, is do this exercise. You're going to find that it's going to deliver more blood and oxygen also to your brain, and it's going to open up your clarity. The other way to be able to do this is to bring your awareness to the present moment is visualization. I do this a lot. And the reason why is because I have a little bit of ADHD. And so I'm like squirrel, squirrel, bell, diamonds, whatever it might be, and it draws my attention. So I have to bring myself back. So I have a visual image that brings me back to that present moment. It's a photo actually of our home in Montana, which we've worked for many, many years to be able to build so we can have a place for us to retire, be able to be outside and hike. So I have this visual that puts me back into a calming set. So then I can put myself into a reset. So visualization actually works as well. So you can even teach this with your students or with colleagues of actually bringing themselves to a place in which that they would actually rather be, would want to be, or they find peace or serenity. So deep breathing and then visualization is number 1. Number 2 is your small task. I really want you to think about, taking your task and breaking them down and breaking them down. But the very first thing that you should do in the morning. So one of the things that I've helped with a couple of the teachers that I work with through one of the school districts here in Tucson, Arizona, is to get up earlier, because they know that their kids actually have to get on their computer and they're starting their computer class, but you need to get some time for yourself. It doesn't actually really mean to do your to-do list or to make out your to-do list. It's to be able to spend some undisruptive time just for you, or before you start your maddening day of opening email, getting breakfast, getting the kids logged on, getting yourself logged on. It's just taking time for yourself. So we call this emotional wellness. It's about actually being thankful or being positive, taking that time at the beginning of your day to start your day in anew, to bring your focus back to your awareness of what's my day going to be like. And if I started in a positive and in a thankful way, then that's how my day is going to start, and hopefully it will end the same way. So, maybe it's praying, maybe it's reading, maybe it's actually making a gratitude book, or it's just maybe even just spending about 5 or 10 minutes of just meditating, just being with yourself and centering yourself, practicing your deep breathing. So, we also call number 3 is unit tasking. What we really want you to do is try to start looking at the things that you need to actually complete and work solely on that. We have a tendency to work on so many different projects. Our awareness then is divided up within those projects. So you need to try to bring yourself back to that one task and work on that one task at a time. Try to get it to at least to start. Then you could come back to it later and then work on a different task, but totally let it go and separate yourself. So we call that unit tasking. So making sure that you're focusing on one task at a time, and start with the small task first, just to get yourself used to working on something like that. We want to try to avoid distractions as number 4. That's why I think that it's so important for you to set up some boundaries, even when you're working from home or if you're back actually in the office as we're managing through COVID. So what I need for you to do is just try to block out your time. So you can explain it even to with the families. Okay, during this time, this is mommy's time, this is daddy's time, and this is auntie's time. I need to be working from this time. I need you guys to be working on this, and try not to have those distractions. You have to maybe even be very, very transparent and very upfront with your supervisors or even with your class members, exactly what are the expectations? What can you do and what you can't do? Because you don't want to get yourself into a situation that you can't deliver what is expected of you. So, but also avoid those other distractions. Like I know right now we're on Facebook, and that's super important because it's streaming out to everybody, and it's a great amount of information that you're going to be able to use for a long time. But be very careful about how much time that you actually spend on social media, because it is going to affect your awareness. It is. It's going to totally distract you and derail you possibly. So be very careful. The other one is stretching. We've talked about the physical activity component of how it increases your happy endorphins, but it also helps break that blood and oxygen, and that allows it to flow into the areas that have maybe been, contracted because of being tense or because you've been seated. So you need to stand up and stretch. You need to get up every hour from your area. And you also need to start really watching your posture. And if there's something that you need help with, when it comes to setting up a work environment, please reach out to a wellness professional. And there's so many great tools online of how to actually set up your office space so that you're protecting your lower back. You're protecting, you're not going to get forward chin. I'm not going to see you in the grocery store in Tucson, Arizona, 2 or 3 years down the line with your old hunchback pushing your cart down the road. We don't want that to happen. So that means that we have to stretch. It's kind of like the dried up rubber band in the utility drawer in your kitchen. You don't use it for a long time, and all of a sudden you take it out and you try to use it and it pops. That's exactly what happens to all of our joints, all of our muscles, and also even the blood and oxygen for your blood pressure, being able to move through. So stretching is a huge benefit for overall health and wellness, not just for, oh my gosh, I feel kind of stiff and tired, I'm going to stretch. So remember, there is any type that you need for clarity as well, or you need to, let's say, for instance, work on your eyesight. You're starting to get blurry because you're looking at your screen or the lighting's changed. You definitely want to get up, change your environment, and stretch for just a little bit, and you'll find a huge improvement. The other one is just finishing your task. Right now, we have so many things that are on our plate, but you need to start practicing and embracing finishing one task completely, because we're so fast and furious about moving on to the next task, moving on to the next one. We forget to actually celebrate our successes. So don't forget to embrace and practice finishing that task, enjoying that, and then moving on to the next one. Intelligent optimism. This is so important that, we have a tendency to be so critical. You guys are all health professionals and you're out there helping others. And I look at it this way as let's say, for instance, a carpenter. A carpenter goes out and makes homes just absolutely beautiful. But if you go to their home, it needs a lot of work. So don't forget, you're out there saving and helping so many people, but you keep forgetting about yourself. So make sure that you start putting yourself first. Practice some really good affirmations. I have this hanging up in my bathroom. You are strong, you are important, and you are kind. So, and the reason why I have that on there is because it's from the movie, or the book actually, is The Help. And The Help, the woman that actually took care of this child, would tell this child, because they knew that their environment was not great. She wasn't going to grow up in a real healthy, happy environment. So she told her as she was a child, those 3 words over and over again. So practicing your affirmations is so important. So find something that works for you. Practice even self-talk. And I don't mean practice negative self-talk. I mean, practicing positive self-talk. Tell yourself in the mirror, how important you are, how strong you are, how smart you are. And then, make sure that you're really looking at your glass. Is it full or is it half empty? So using those words will bring back your total awareness to better self-care of taking care of you. You're first, you guys. Also start checking your surroundings is number 7. Make sure that you're organized. If you're a mess, then you're delivering a mess. And I know that might sound mean and ugly, but it is true. So take a look around. And that's one thing that I've enjoyed so much about Zoom is looking at everybody's workspace of what it actually looks like, even especially on like even some of the news channels, is what kind of book do they have on their bookshelf? Now I think it's all staged, but at the beginning it wasn't staged. So make sure that you're really organized. And then that way you can also effectively switch over to your next task and be ready to take on that task. It's so important to set your priorities. You guys, before COVID, think about some of the things that you wish for. One of the things that I used to wish for is, oh, I wish I had more time at home. Oh, I needed to do X, Y, and Z. Oh, I wish I had more time with the kids. Oh, I wish that I was a better wife to my husband. On and on and on. And look what happened. We got quarantined. So now we're locked in with our kids and our husbands and our significant others. So be careful, but set your priorities. What do you really want? What do you want? Put it at the top of your list of what you want. Change your outlook. Guess what? This is our new way of living. It's like this. When you travel to a foreign country, you don't maybe know the language, you don't know where you're going at all. You're hoping that somebody can actually guide and direct you to the places that you actually need to be or to do. So think about that. Our lives have changed so much. It's like that we went into a foreign country and now we have to learn everything all over again. But guess what? We have a clean slate. We get to actually set what we want to come out of it. So change your outlook. Look for it exactly. How's this going to make me better? I don't know about you, but I hadn't got to read a book. Read a book. I got to listen to a book because I was in my car all the time going from one place to the next place to the next place for work. But I didn't have the chance to really sit down and read a book. And if I did, when I got home, I would fall asleep and would never get to read it. Well, I've got to read several books while I've been at home. So think about the things that are positive things that made a difference that now you can carry on. And then, be open also for change. I know it might be scary, but this is it, you guys. This is our new way of living. We have a country that's divided. So what side are you going to be on? What side are you going to be on for yourself? So commit to doing your best every single day. And guess what? The best will come out of it. So these are just your benefits about being mindful, just so you know. So everybody wants to know, well, what is it going to do for me? Well, it's going to increase your focus. So that means that you're going to be able to get things done a lot quicker. You're going to enhance your learning skills by being able to do that because you're going to clear out all the cobwebs by being mindful. It's going to help you manage your stress. It's going to boost your energy levels. It's going to improve your working relationships. You're not going to be so mean and ugly on Zoom. And then you're going to help others become more grounded. That's one thing that's so important about the field in which that you guys are in. You're out there helping others. So when you can lead by example, then you're going to be able to help others, right? And then it's also going to decrease your physical stress as well. So I want to leave you though with one of the most important things is humor. And that's what I did love about the video. Now, granted, it might have been a little harsh, but bottom line, it made me laugh. It made me laugh. And with our immune systems right now, it's super important that we have laughter in our lives because 1 minute of anger weakens your immune system for 5 hours. And remember, that's what we're trying to do is boost our immune system so we don't get COVID. But 1 minute of laughter strengthens your immune system for 24 hours. So I want you to think about this. This could be something that you could really even do with the associates that you work with the kids that you work with, is bring laughter back in. It was really very heartwarming. My 30th class reunion, one of my classmates came up to me and said, I don't know for sure if I ever told you to tell your father thank you. I'm like, and then he asked if he's still alive. I'm like, yeah, he's still alive. And I said, why would you want to thank my dad? And he said, well, his dad worked for my dad in the oil refineries. But every day my dad brought in bazooka gum or Laffy Taffy. And each employee had to go around, open up their Laffy Taffy or the bazooka gum and read the joke of the day. But what that gentleman did is he brought it home to Mike, and at dinner, they would read the joke of the day. So remember, you're constantly, everything that you're doing, you're able to do for others. So make sure that you bring in some humor as well. Now that ends my presentation, but I have one more little thing that I'm going to read to you. And this is from one of my favorite television and authors, Dr. I'm sorry, not Dr. Mr. Rogers. And this is what he says. When I was very young, most of my childhood heroes were capes, flew through the air or picked up buildings with one arms. They were spectacular with a lot of attention, but I grew up and my heroes changed. So now I can honestly say that anyone who does anything to help a child is a hero to me. And I feel the same way about you guys. So best of luck, but if you need any help at all, we're here to help.
Thank you, Andrea. That was awesome. Thanks. That's great information about finding balance. I will say that during that presentation, you made me sit up straight in my chair. I did my deep breathing, and I actually can attest that I feel much better now after all that. I do want to let everybody know that today is National Kindness Day. I just want to say thank you to all of our presenters. I don't think we have any more time for questions, however. So I'm going to hand it over to Lisa to close us out.
Thank you, Dr. Diebolt. Incredible energy, like passion, and great information for us to apply. As you know, we have a few technical difficulties at the beginning, and we were not able. I was trying to get this screen up to share with you to let you know who Dr. Amy Diebolt is. She's been a school psychologist since 1991 and recently retired after 29.5 years working in the public schools. In the last 4 years of her career, she was the lead psychologist for the Tucson Unified School District. She is a board certified in school neuropsychology and maintains a small private practice focusing on neuropsychological evaluation for children and adolescents. She's currently an adjunct professor at the University of Arizona in the College of Education School Psychology Department. And Dr. Diebolt has served as member at large for the Southern Arizona Psychological Association Board and has served as the Southern Region Director for the Arizona Association of School Psychologists Board, and was also honored to be named one of the NASP 2017 Model School Psychology Intern Supervisor. So I didn't want to pass this as we had intended to introduce to her. She has been facilitating this amazing conversation among the panelists. So now it's time for you to think about, what would you do? What are you going to do different? I hope you were able to note at least 3 things that you can apply to your daily life. Let me try to, oops. So as you recall, during our introduction, the word of possibility suggests that even something as small as a seed can grow into something magnificent. The word power implies that things can be and will happen. When we focus on what is possible, we have hope that things and objectives will grow, thrive, and bloom, empowering us to take the action steps necessary to do so. So today is the opportunity for you to take action for you. Thank you so much for joining us, and thank you to all the presenters for sharing their knowledge and information with us.
Yes, thank you.
Have a great day.